Hi everyone. Hello. Okay, so don't laugh. This is my first time doing a legit YouTube video. I don't like having myself being filmed, and I do not like the sound of my voice on a recording. I think I sound like a 5-year-old, so don't laugh. Anyways, my name is Chelsea. I am a second year nursing student at Rio Hondo College in Whittier. Whoop whoop, go Roadrunners. I graduate this May 21st to be exact, and then I take state boards and become a registered nurse. Yay! So, this first video is just gonna give you a little taste of, who I am, who's this chick that's on this video talking up a storm and whatnot. And then I'm just gonna give you some advice to help you be successful in nursing school. So yay, if you're watching this and you got accepted to nursing school, congrats. Yay. Okay, so my personal experience, well, maybe I should tell you more about myself. So yes, I go to Rio Hondo College. Highly recommended to anyone out there. That was a 2-year community college nursing program. Very difficult, but it's worth it in the long run, trust me. So I'm at Rio Hondo College getting my associate's degree in nursing, but I'm also concurrently enrolled in a nursing program, a bachelor's program to be exact, at Cal State LA. Woo! Go Golden Eagles! So yeah, I'm kind of doing those at the same time. Long story short, it's a collaborative program. It's the first of its kind in California. And it's funded by the Robert Wood Johnson Foundation. So if you want more information, feel free to go to their website and just type in the Cal State LA Collaborative Program. Because it's a lot to talk about in the short amount of time I want to do this in. When I graduate, of course, I hope to get a job, any kind of job to be exact. But right now, I actually tutor in nursing at Rio Hondo College, which I absolutely love, and I love all my first-year nursing students I tutor. Hi guys, if you're watching. I tutor in beginning and advanced medical surgical nursing, pediatrics, and neuro/geriatrics at our school. I love, love, love learning, which you kind of have to in nursing because you learn every day, but I also absolutely love to teach. So my future goals are to graduate from Rio and Cal State LA with my bachelor's, and then apply to their master's, their adult nurse practitioner program, and then maybe get a postmaster certificate in education. Then maybe my doctorate somewhere down the road, but of course I want to work wherever and gain experience, but come back to good old Rio Hondo College and teach as a nursing professor in the classroom and clinical setting. So I'm excited. I kind of have a plan, a future in mind, and it's looking real bright. So I hope everyone who's watching takes my advice and my study tips and whatnot and can be as successful as me. Put in the hard work and you'll see in the long run it's worth it. Okay, so what we're all here to know is how to be successful in nursing school. Nursing school is hard. Let me tell you that. Some days you're going to be really happy. You're going to jump for joy when you do your first enema and high-five your friend. And then some days you're going to be crying in the corner of your room, or, it's never too early to drink. You'll go to the local bar and do a couple shots, get over it, and move on. That's nursing for you. It's constantly ups and downs and whatnot. The only question is, how are you going to cope and handle it in a positive manner, might I add. So, some of my tips. Well, there's lots. So, how to study. That's a good one. It's a good one to start with. Well, you can talk to any of my friends and teachers. I'm kind of a nut and a OCD per se when it comes to studying. I'm a neat freak, and it helps me. So when it comes to studying, what I do is in nursing school, you're gonna find there's lots of reading, lots of pre-reading, and it's just gonna seem really overwhelming. So first of all, you want to pick out like a nice place, if it's in your house or you've got kids, too much going on at your house, somewhere away from your house, like at a coffee shop, Starbucks, whatnot, a library to study. You want to make sure you're in the right mindset, you have no distractions, and you've got some peace and quiet so you can study and retain the information. That's important. So, of course, always pre-read. You need to. You actually need to open up your textbook and read what's going on, because if you don't, you're going to miss vital information. And in nursing school, that information is what potentially makes someone stay alive or not. So it's really important you read and you know what's going on. So that should be some good motivation. Light a fire under your butt to study. What I do is I take the chapters and whatnot that are assigned. I take my highlighter, whatnot. Yes. And I highlight as I read, and I highlight only the important aspects, things that stand out to me. And then what I do is I go back and I type out notes, but the key is I don't copy exactly word for word what's been highlighted. Key is to put it in your own words so you can understand. Yes, you'll find that especially if you have not had healthcare experience prior to coming into nursing school, a lot of the medical terms, jargon, whatever, it's going to be kind of intimidating. So have your medical dictionary by you and just make sure you're putting things in your own words. Trust me, it's going to help you a lot, especially understanding material, doing well on tests, but also one of your roles as a nurse is to ultimately teach your patient on their disease process and whatnot. And we don't use medical terms, we kind of put them in layman's terms. So again, it'll help you in that aspect also. So type notes, read folks, open your textbook. My other advice is to buy some kind of NCLEX review book. Yes, you have just been accepted into nursing school and you're here on day one. It's never too early to study for NCLEX, guys. And the one I use and I actually love is this Saunders. It's a 5th edition. It's yellow. I got it for like $30 or like $25 on Amazon. Saunders, can't miss it. It's yellow. 5th edition. And what's great about it is you'll find when you go through the book, it literally has everything. Pediatrics, oncology, pharmacology, and then it breaks up things into different body systems, you name it. Respiratory, cardiac, GI, you name it. And it talks about specific diseases and medications. But the best part about this book is it's got NCLEX style review questions at the end. Yay! You will come to find in nursing school that the exams are your freaking enemy. You will take tests. Literally, these things are nothing like you've ever done before. Just everything that you know about exams and whatnot in your past, just throw it out now, because you're in a whole new ballpark when it comes to nursing school. Trust me. When you take your first exam, you're like, what the hell? Yeah, I told you so. Feel free to comment your reaction after that. And I say buy an NCLEX review book so that way when you're studying a certain disease or a body system, say respiratory, well, you can just flip to the respiratory chapter and take NCLEX style review questions pertaining to whatever you're learning in school, because that's the way the teachers are going to create the tests. They use test banks, NCLEX review questions or whatnot, sorry. because they ultimately want to prepare you for graduation and to take your state boards, your NCLEX exam. So that's my advice. Take lots of practice test questions. It will most definitely help you, especially if you're not a very good test taker like I am. It took me about into the first year of nursing school to really get into a good groove and certain test taking strategies. So I wish I would have started with the Saunders NCLEX review questions from day one. I didn't. It probably would have helped me a lot more, so I'm telling you guys now. As far as test taking strategies, you will feel kind of rushed because there is a time limit on tests and whatnot. If you get really distracted by noises and whatnot, try to bring earplugs to block out noise, or if you can actually fill out a form in your school to take your tests in an actual test-taking center. You just want to create the right environment so that you can do the best you can on your tests. And then while you're taking it, what I do is I take a highlighter. Of course, highlighters are like my best friend. And you'll see me, or if you've graded my tests, I'll have colorful highlighters, markings all over it. And I usually use this one, a bright neon orange. And what I do is I'm reading the question, I highlight things that stand out to me. And a lot of the things that I highlight kind of help me choose my multiple choice answer. Because a lot of the times they give you like a lot of fluff or junk, so to speak, in the question, but key items would be like, patient is post-op from a cholecystectomy 1 day, or certain trends and vital signs. Things like that you should be highlighting. They're going to help you determine what your answer is. Of course, try not to erase anything. I swear, guys, the eraser is your enemy. It is not going to be your best friend in nursing school. Alright, try not to change your answers unless you're absolutely 100% positive that you chose the wrong answer and you need to change it. Because a lot of the times, when you do change your answer and you go back after your test, you've gotten them all wrong. And you'll know it when it goes through the Scantron machine and your teacher's grading it, and it makes that horrible sound every time it comes across a wrong answer. Yeah. So try not to bring your eraser with you, okay? Don't change your answers. Trust me. Invest in a good drug handbook. Try to stay current as always, because things do change in the medical field, especially when it comes with like drugs and whatnot. I use this guy, 2013 Nurse Drug Handbook, and this is Lippincott, Williams, and Wilkins. And this will help you in the clinical and in lecture to look up certain drugs. Also, I have this guy. It's information on diagnostic tests and certain labs, what they mean, if they're high or low or abnormal. This will also be your best friend in your first year of nursing school, because this is all new. You're studying a whole new language, so to speak. Let's see. Try to be organized. Stay on top of things. In nursing school, things are going to move by really fast, especially if you're on a quarter system and you're learning all this new material, and your quarters or whatnot, like I know here at Rio, some of them are run only 8 weeks long, including finals. So you really have to stay on top of your game. I swear to God, I have Post-it notes. Yep, that's some of them. One of the many. And of course, I have like 2 calendars. One on my cell phone, one on my wall, that tells me when journals are due, when quizzes and exams are. Because God forbid you do not want to miss those and lose points, or not even be prepared and not allocating good study time to be prepared for that. You'll find in nursing school that there are not that many assignments. There may be like 1 paper, but welcome to college. Majority of your course grade is going to be based on your quizzes and your exams, your midterm and your final. So you do want to do as best as you can on those so you can pass the class. Let's see. So just stay on top of things. Get a calendar, folks. I swear. Take it with you everywhere so you're on top of things. First year nursing students. One thing that helped me out big time as far as learning the labs and whatnot, what they mean when they're high and low, is I actually wrote certain labs and whatnot that I learned as I went in the first year of nursing school or first semester on flashcards. And then I wrote underneath the normal value, like if your lactate level, we know normally it's 3 to 7 milligrams per deciliter. So that would be on my flashcard on the front. And then underneath, I would know that anything greater than a 7, so an elevated lactate level, would mean that our body doesn't have enough oxygen, usually in sepsis, and we'll learn about that later, but it's not a good thing, right? So I list things why an elevated lactate level would be happening in the body. Same thing for as if it was the opposite, if it was too low. And this is just helping me as we go along. That way when I come back from my second year of nursing school, I know all my labs pretty much, and I know why they're high and low, and I can just name them off the spot. And it just makes you look better, and it makes you more prepared, and you can act quicker for your patients. And what I did is I actually taped all my flashcards on my wall, so that way when I'm studying here at my desk or I'm in bed trying to sleep or whatnot, my brain can't shut off. I can actually look at my wall and study my lab values. And I'm telling you, don't laugh, my room's really dirty. But that is my lab value wall. And I'm telling you, it will help you in the long run. Trust me. Let's see. I think that's all for now as far as studying and test taking. I don't know, I can't really remember, it's been so long ago. When you take fundamentals of nursing, you're not really studying diseases, I think, in that one. I can't remember. Ooh, it's all a blur now. But when it comes to that time, when you're going to start studying the different disease processes and whatnot in the body systems, respiratory, cardiac, GI, whatnot, it's going to be really intimidating. But my biggest piece of advice to you, and I tell this to all kids I tutor, do not, and I repeat, do not memorize it. No, you might have gotten away with it when you took physio and anatomy, just straight up memorizing everything. It's not going to help you in nursing school. I'm just telling you that right now. You actually have to understand the material in your own words. Trust me. So my biggest advice is when you're studying, let's say, a thyroid disease like hyperthyroidism, you want to put the patho in your own words, basic signs and symptoms, and a lot of times, like on the internet and different books, you can find really cool mnemonics to help you memorize signs and symptoms. But if you know what the thyroid does for us under normal conditions and what's happening if it's overacting, like in hyperthyroidism, then the signs and symptoms are going to make a lot of sense to you. And then you're going to know, okay, if it's affecting my thyroid, then labs I'm going to look at are a thyroid panel. I need to look at those hormones to see why they're all funky and whatnot. And then if I know my signs and symptoms in my labs, then I'm going to know what to do for my treatment. We know in hyperthyroidism, they sometimes have really high blood pressure. So potentially, I'm going to have to give them a medication to lower that so they don't stroke out, right? You need to have good blood pressure. Also, I might have to give them something to make sure that they don't keep over-secreting this thyroid hormone, because for whatever reason, their body's not shutting it off. So it just keeps over-secreting this thyroid hormone. So kind of look at it in that aspect. Try to correlate everything together, and just please don't straight up memorize everything. Try to connect the dots, so to speak, and just put things in your own words. Um, so that is my biggest advice for you guys now. Good luck and congrats on getting into nursing school. Super proud of you. You're all going to make great nurses someday, and you're taking the first step to do so. So take the reins on your education, and I hope you guys are successful. And tune in until next week. We're going to go over basic dimensional analysis on how to calculate dosages and whatnot for different meds. And yeah, we'll see where it goes from here. So, bye everyone. Have a good weekend.